I'm sure you know already, but if you didn't, we have 3 other TLDR YouTube channels: EU, US and Global. Learn more from all of these videos and channels by clicking the links below and subscribing. So we're going to be tackling a particularly controversial topic, the NHS. As anyone who lives in the UK will know, the NHS is the closest thing we Brits have to a national religion. Criticising it amounts to sacrilege, which is why the Conservatives, who aren't generally that keen on nationalising public services, usually avoid saying anything bad about it. Unfortunately, this is a slightly unhelpful attitude. Of course, the people who work in the NHS, who've committed their careers to saving people for pretty mediocre salaries, deserve a lot of credit. But the NHS as an organisation isn't a perfect health service, and pretending as much prevents politicians from having constructive conversations about how we might improve it. So in this one we thought we'd have a go ourselves and see if we can figure out how to fix the NHS. The first big problem that needs fixing in the NHS is waiting times. Over the pandemic, the NHS England waiting list increased by nearly 1 million, from 4.4 million in March to about 5.3 million today. Things are expected to get quite a bit worse because with coronavirus, people didn't go to the doctor as much as they otherwise would have. If you compare the number of people joining the NHS waiting list over the pandemic compared to pre-pandemic, you'll see that 7.4 million fewer people than expected joined the list. Which means that we could see another 7.5 million people or so join the waiting list relatively soon, taking the waiting list to a total of 13 million people. This is something that Health Secretary Sajid Javid warned about a few months ago, and would, in practice, mean about 1 in 4 people in England on some NHS waiting list. This is currently the biggest problem for the NHS. Waiting lists are insanely long. Nonetheless, this is sort of to be expected. We had a once-in-a-generation pandemic after all, and Simon Stevens, the outgoing head of the NHS, reckons it can get back to pre-pandemic levels with an extra £10 billion of funding annually over the next few years. But even pre-pandemic, the NHS wasn't perfect. Don't get us wrong, the NHS is absolutely brilliant in many respects. It provides uniquely good protection to the public from the consequences of ill health, and basically no one in the UK is priced out of quality healthcare. The NHS is also impressively good at certain things, like diabetes, kidney transplants and vaccinations, with both high COVID and flu vaccination rates by international standards. Nonetheless, in general the NHS doesn't have very good outcomes. Essentially, once people are through the hospital door, they don't have great odds. To measure this, data scientists usually use a metric called amenable mortality. Amenable mortality is essentially a measure of the number of preventable deaths that occur per person in a country. So if your country has a high amenable mortality rate, that means a lot of people dying when they shouldn't be. The UK has a higher than average amenable mortality rate compared to similarly developed countries. Eurostat data from 2015 found that the UK had a higher amenable mortality rate than basically every equivalent EU country, including Germany, Spain, France, the Netherlands and Portugal. Similarly, a global burden of disease study found that the UK had one of the highest amenable mortality rates in the developed world, with only the US doing significantly worse. So, why is this? Well, it's basically because the NHS isn't very good at treating certain life-threatening illnesses. The UK has below average 5-year survival rates for basically every cancer among developed countries, according to a 2014 Concord 3 study. The UK also has below average outcomes for heart attack sufferers, and remarkably poor neo and perinatal mortality rates. Obviously, if you've got high mortality rates for heart disease and cancer, 2 of the biggest causes of death in the developing world, you're going to have a pretty high overall mortality rate. So what can be done about this? How can we fix the NHS? Well, obviously this is a 9-minute video written by a bloke who works for a YouTube channel, so we're not going to be able to provide a complete plan for fully fixing the NHS right now, but there are some obvious answers. First, the NHS probably does need a bit more funding. When we hear politicians talk about the immense amounts of money being spent on the NHS, $1 billion here, another few billion there, it's tempting to think that the NHS can't really need any more money. But the NHS is actually relatively underfunded. The The UK spends less than average amongst developed countries on its healthcare system, both as a percentage of GDP and per capita, at least according to data from the mid-2010s. This is part of the reason why the NHS has relatively few hospital beds and medical staff. The NHS has fewer doctors, nurses, pharmacists, dentists and physiotherapists than its counterparts, and just 2.6 hospital beds per 1,000 people, one of the lowest in the developed world. Unsurprisingly, the NHS therefore has one of the highest rates of bed occupancy in the developed world. In England, for example, on average 90% of beds were occupied in the last quarter of 2018. In a sense, this is a testament to the NHS's efficiency. It's not spending more on beds than it needs to, but it also means it's basically running at full capacity the whole time, even pre-COVID. So that's an obvious partial solution. Spend a bit more on the NHS, hire some more doctors and buy a few more beds. This isn't a particularly creative solution, but it's undeniable that with an ageing and expanding population, the UK is going to have to spend more on the NHS in the future if it wants to continue providing the standard of care it currently does. There are other things the UK can do though. As well as improving NHS capacity, there are ways to reduce strain on the NHS. For example, the UK has one of the highest obesity rates in the world. Obesity increases your risk factor for just about everything: COVID, heart disease, even certain types of cancer, which obviously puts more strain on the NHS. Public health campaigns or tax incentives to reduce the rate of obesity in the UK would go some way to reducing the NHS's workload. A final option would be to increase the amount that patients pay for their care, say with a £10 charge for every GP visit. This isn't the same as privatisation. The NHS would still be run by the government, just financed slightly differently, and it's not a completely new idea. The NHS already has charges for prescriptions and dental care, and has done so for years. These charges help fund the rest of the NHS. The gross income from prescriptions contributes about £500 million to the English NHS, and dental charges contribute even more, around £800 million. With 350 to 450 million GP visits a year, a £10 charge would raise between £3.5 and £4.5 billion annually. Ideally, these charges would also discourage people with trivial complaints that don't actually need treatment from going to the NHS and putting an unnecessary strain on the system. But the potential downside is obviously that any charges might also discourage people with serious conditions who can't afford that extra £10. A now famous RAND health insurance experiment carried out in the 1980s found that these sorts of charges actually most discourage those who need care, older people and the poor. We're not saying we endorse this policy here, it's just that as the population ages, the government's going to have to spend a lot more money on the NHS, which presumably means higher taxes or coming up with a creative new way to fund it. And this might be an option. But what do you think? Is it unfair to make people pay for their GP visits, or is it a necessary step in maintaining NHS finance? Let us know your comments down below. Also, down below are links to TLDR EU, US and global, where we've recently discussed things like the EU's plan to force everybody into using USB-C, if the Republicans are going to snatch back control in the 2022 midterms, and why the lights are going out in China as they suffer an energy crisis. All those and more can be found if you subscribe to the other TLDR channels, all of which are linked below. Special thanks to our Patreon backers who make videos like this one possible, and if you want to see your name at the end of videos, then you too can back us on Patreon. The link to that is in the description below.